You have managed the crisis of times, which is COVID-19 pandemic. And in fact, the government of India at that point in time rolled out a lot of technological solutions like COVID for vaccination and Arogya Setu for contact tracing and e-telemedicine service e-Sanjeevani. So now what role of technology do you see in managing a crisis like COVID-19?
I just want to highlight that had it not been for technology, we would not have been able to manage COVID-19 to begin with. India started managing COVID-19 through its not use of data alone, but data-first approach. I would just like to highlight that we had our COVID-19 India portal. You don't hear about it because this was an in-house portal and is still running. That portal became the mainstay of collation of data from each and every district in the country on a daily basis since February 2020. This software, this portal was supported by multitude of the other initiatives, some of which you have already alluded. Contact tracing supported by Arogya Setu, 220 million downloads. e-Sanjeevani platform, which facilitated when people could not come out of their houses, but they could still get health services, health related information and the prescription by a doctor. More than 150 calls have been done till yesterday. Similarly, we are all aware of the public interface of CoWIN, wherein we are aware that 2.2 billion digital imprints of each and every dose given across the country was monitored. Let me also highlight there were other integrated tools which we prepared, and this actually would respond to the point Ms. Neetu you mentioned, that if we were to ever manage a next health emergency, are we ready? So, if you see 930 million tests done in the country, they're all monitored through a RT-PCR and ICMR portal. And this data would come to us on a daily basis, and based on which we were able to identify trajectory of cases, case positivity, and based on case positivity, what needs to be done at any point across the country in any district or in a sub-district level also. Similarly, we had a facility app. We had even monitoring of oxygen demand during one of the wave was done through an IT portal. Based on the oxygen demand, how the movement of the oxygen cylinders needs to be organized, the oxygen tracking system also was done through computer. Genomic surveillance was done through IT platform. So what I would like to highlight is that had it not been for technology, we probably would not have understood that trajectory, and based on which we would not have been able to analyze what needs to be done to begin with. And when it comes to managing any future health emergency, my submission would be only one. The question today for us is if the next health emergency will happen or not. The question is when it may happen. So we need to be prepared. And to that extent, we strongly believe that the technological tools which India utilized in its ongoing battle in COVID would be further strengthened to ensure that we'll be able to manage any health emergency better in future also.
So now how government of India is trying to integrate technology in the total healthcare ecosystem?
This actually is a very interesting question. You know, if we see historically, Ministry of Health collectively, including also states, we had actually been taking a lot of digital health initiatives. And over a period of time, we realized that while India has done exceedingly well in terms of using technology, parallelly we realized that all these softwares don't talk to each other. And that is where you realize that whatever problem which we have in the physical space, lack of communication between human beings, we had effectively translated it also into the cyberspace, something which I call egos of the softwares. The need of the hour then has been to focus on ecosystem approach. And that is where I would like to highlight that around 5 years back, Government of India came up with the National Digital Health Blueprint. And that blueprint became the basis for launch of Ayushman Bharat Digital Mission. What is very critical is that when you get data, and if you can plot that data longitudinally, something which you call longitudinal electronic health record, the insights which it throws actually saves a lot of money to a patient, avoids repeated diagnostics, and facilitate precision medicine. Let me compliment you for highlighting the fact about not only AMR, but also the fact that the drug discovery also in future will be facilitated by technology. Artificial intelligence, generative AI, there are case studies which are happening across the world where we are trying to use generative AI to actually speeden up the process, what could the probable mix and match of combination of drugs which can be useful. So thinking that as an approach, what we are doing is that we are actually creating an ecosystem approach, an architectural approach on digital health usage in the country. And I'm happy to highlight, yesterday, Honorable Minister of Health from Tanzania was visiting our control room, which we call National Public Health Observatory, where the digital data across multiple programs are collated, whether it is blindness, whether it is disease surveillance, whether it is happening because of TB or any other communicable diseases or maternal child health, the whole data gets collated, coupled with the financing, coupled with the health infrastructure to come up with those insights which actually become the driving force to drive policy on the field. So I think from our perspective, what is very clear is take the full advantage of data, break the silos of the system. And as part of that process, this Ayushman Bharat digital mission will be a game-changing event for this country.
Okay, since you are telling us that a lot of other countries have also shown interest in our technological solutions that you have recently rolled out, but these mammoth tasks don't come without challenges. So what kind of challenges have you faced or are still facing in implementing these technological solutions in a country like India, where we talk about rural India having network issues and all that? How are you facing all these challenges, and what are the ways you can overcome this?
So actually challenges had always existed. You know, you surmount a challenge, but again you realize that another component technology offer another interesting solution, and for that there's another additional challenge to be managed. So to that extent, challenge will remain a continuous engagement process where new technological tools will be developed, surmounting those new challenges or new insights which can fall in place. But if I were to highlight what could be those generic challenges which always will remain our focus area. So the first and most critical challenge would be basically to control this cycle of epidemics of pilots and create an ecosystem or an architectural approach. If you see a lot of international organizations, a lot of states, multiple times we basically launch a pilot, the project gets over, the technology loses value, and then again it is business back to user. So what we are saying is that when you actually take up a technological innovation or a technological tool is put in place, please think of it to begin with where it is going to be used and what is its sustainability framework. And where does it fit into the overall Ayushman Bharat digital mission infrastructure? Based on which, once you have launched something, after that, how does that, whatever framework you are adding, will basically be put for public health policy. I would like to just give you one simple example. Artificial intelligence, people were talking about it. I knew a lot of organizations are working on artificial intelligence. But my biggest agony was that whatever they would do, they would not even discuss at times with government, and they'll create a solution which probably is not my priority today. So then what we did is we created this concept of digital public goods, and in ministry I have an embedded team working on artificial intelligence today, where before picking up a solution, we take a decision where it is going to be put to use and to taken to scale at national level. Example is telemedicine eSanjeevani. Now in eSanjeevani, triaging is done through artificial intelligence. Second example is when I am doing disease surveillance in the country today. You talked about early insights. 11 languages across the country are monitored through artificial intelligence tool for any media coverage of any identified 36 diseases, and I pick up those cues and straight away send them to district to react. So how do you basically, whatever you do, become a framework for nationwide expansion is what we are trying to work on. And another challenge in terms of, to that extent, you need to focus on capacity. To that extent, you also need to come up with those low bandwidth solutions, which can actually work without requiring too much of bandwidth. And also you need to create this framework where we remain oriented and we remain agile to the fact that if there is a new tool or new technology which is coming up, let's talk about generative AI. Am I responsive enough to actually integrate into my health system? Would become another critical ongoing task which you would need to focus on.
If you like the video, do like, comment, share and subscribe.